Diet soda and artificial sweeteners are the worst thing you can have for your metabolic health, and these ingredients could lead to increased risk for type 2 diabetes and cardiovascular diseases, right? And let me explain you this today, right? So when you're consuming artificial sweeteners and diet soda, whether you're consuming these diet coke, or these sort of carbonated drinks, or even you have artificial sweeteners in your toothpaste, right? Your oral microbiome actually sense these molecules, these ingredients, right? And they pre-digest and pre-process them. And with the speed of light, they send a biochemical signal to your pancreas, telling them that they've encountered something sweet, and pancreas should start releasing insulin, right? And the insulin is released in the bloodstream, but there is no glucose to be metabolized because artificial sweeteners have no glucose, right? And this leads to high level of insulin in your bloodstream, and leading to high food cravings and hunger, right? And what happens next is a vicious cycle, and you become insulin resistant, right? And you have type 2 diabetes, and you increase risk for cardiovascular disease. This is one aspect of it. Second aspect is when you are consuming these diet sodas, it actually these are very acidic, right? And your oral microbiome actually interact with these molecules, these acids, and produces something called lactic acid and succinic acid, which changes the pH level of your mouth, and it goes below the critical pH. And then when it goes below the critical pH, your calcium starts dissolving. You cannot remineralize your teeth, and then you have cavities, and this lead to oral microbial dysbiosis, and then it triggers a lot of oral health issues such as cavities, and increases for gum disease, and even this could have a downstream impact on your metabolic health, right? So do not think that replacing your sugar with artificial sweeteners and these diet sodas are going to help. They are rather going to harm your metabolic health in a very big way, and you're going to increase your risk for cardiovascular disease, type 2 diabetes, and other metabolic health issues, and even oral health issues.